So now we move on to the parotid region, and in parotid region, apart from the parotid gland, we see the facial nerve. But before going to the facial nerve, we have to study the parotid gland, and this parotid gland is also one of your important questions that is asked in the exams, important structure in the body. Paraotic, that's how it gets its name. Around the ear, parotid. This parotid gland lies between the mandible and the mastoid process, but it extends over both of them. This parotid gland, when you look, it looks like an inverted pyramid from the side. In this, you can see that here will be the external auditory meatus. So this is superior surface, this is anterior border, this is posterior border, this is apex. This superior surface is also called as base. Base, apex. So base is upwards, apex is downwards, anterior border, posterior border. Okay. This surface is also called as superficial surface. Now if I take a cross section, at this level, then what do I see? I see the mandible like this, mastoid process like this in a transverse section. And here is the parotid gland. So here is the anterior border, here is the posterior border, here is the superficial surface. ये surface मैंने ऐसा section लिया. Sorry ये मेरे साथ होता रहता है. Okay. So this is anterior border, this is posterior border, this is superficial surface. So parotid gland is not restricted like this, it goes in between these two structures also. मतलब यहाँ पे mandible है, यहाँ पे mastoid है, so it is not like this, it goes inside. It goes inside these two structures also, and there we see two more surfaces. There we see two more surfaces. Anteromedial surface and posteromedial surface. And we see one more border, and that is medial border. So in a cut section, I can see that there is anterior border, posterior border, medial border. Superficial surface, anteromedial surface, posteromedial surface. Apex or superior surface, apex and base or superior surface. Okay, that's the morphology of the gland. Now let us see what all structures it is related to. Base is related to the external acoustic or external auditory meatus. It is also related to the temporal branch of the facial nerve. Apex will be related to the cervical branch of the facial nerve. Right, facial nerve divides. Then the superficial surface will be related to the skin, superficial fascia, deep fascia. When we studied the deep cervical fascia, we said the deep cervical fascia splits to enclose parotid gland and submandibular gland. Okay. So, so that's how the capsule of the parotid will be formed by the splitting of the investing layer of the deep cervical fascia. Anteromedial surface. Anteromedial surface. What is this? मैंडिबल. मैंडिबल के बाहर के साइड पे एक मसल होता है masseter. So anteromedial surface is related to posterior border of mandible and masseter. Masseter. Exactly inside the masseter. Exactly inside the masseter. Same way the fibers of masseter run like this down. On the inner side there is a muscles with similar fibers running, and that is called as medial pterygoid. Medial pterygoid. Pterygoid में P silent है. Okay. Medial pterygoid. So एक बोन दो मसल. Anteromedial surface. Posteromedial surface also एक बोन दो मसल्स. बोन कौन सा है ये? मैस्टॉइड. उसको अटैच्ड मसल कौन सा है? स्टर्नोक्लाइडोमास्टॉइड. और कौन सा मसल वहां पे अटैच्ड है? पोस्टीरियर बेली ऑफ डाइगेस्ट्रिक. So anteromedial surface is related to mandible. It is related to mandible, masseter, medial pterygoid. Posteromedial surface is related to mastoid, sternocleidomastoid, and posterior belly of digastric. Posteromedial surface, so this is lateral side, this is medial. It is also related to the styloid apparatus. Styloid apparatus. What is styloid apparatus? Styloid process and the muscles attached to it. Stylopharyngeus, stylohyoid. Okay. Now medial border is related to the wall of the pharynx. Medial border is related to the wall of the pharynx. Okay. So again I'll repeat, parotid gland lies between the mastoid and mandible. It has a base which is upwards related to external auditory meatus, apex directed downwards, through which the cervical branch of the facial nerve comes out. It has superficial surface covered by skin, superficial fascia, deep layer of investing fascia. It has anteromedial surface which is related to mandible, masseter, medial pterygoid. It has a posteromedial surface related to digastric, sternocleidomastoid, mastoid process, and styloid apparatus. Anterior border is related to the nerves coming out. So the facial nerve which will pass like this, the branches will come out of the anterior border. Posterior border related to mastoid, and inside and medial border is related to the pharynx. Now there are three structures lying within the parotid. Structures lying within the parotid. So I am drawing three parotid glands like this. So here also I have drawn facial nerve. Okay, I'll make it. So facial nerve is the most superficial structure. It is passing through parotid. Therefore, during surgery on parotid, one has to be very careful that facial nerve, we have to operate superficial to facial nerve and deep to facial nerve, but facial nerve should not be destroyed. Okay. नहीं तो पूरा का पूरा ग्लैंड निकल गया, person's face will be distorted. The second structure is retromandibular vein, and the third structure is external carotid artery. So these are the three structures. I am drawing separate diagram for these three structures. Most superficial structure, facial nerve and its 5 branches. I don't have to repeat. Cervical, temporal, zygomatic, marginal and cervical. Okay. Then the retromandibular vein is here. It is formed by union of superficial temporal and maxillary. Then it comes down here and its 2 branches leave. This is retromandibular vein formed by the union of maxillary and superficial temporal. Okay. And its 2 branches leave anterior joints facial to common facial, posterior joints posterior auricular to form external jugular vein. Anterior unites with facial to form common facial vein. But ये बाहर होता है. Main thing is retromandibular vein. Its formation and its division lies inside the parotid gland. And the third thing is external carotid artery entering through the apex. External carotid artery entering through the apex. 5 branches of the external carotid artery are given in the carotid triangle. Remaining 3 branches are here. The two terminal branches, maxillary and superficial temporal, and 1 branch, posterior auricular artery. Posterior auricular artery. Posterior auricular artery. Okay, so ये 3 diagrams आपको बनाना है for structures lying within the parotid gland. ये diagram for morphology. ये diagram for morphology and the relations. So 3 structures lie: facial nerve and 5 branches, formation of retromandibular vein and its 2 branches, and external carotid artery and its 3 branches, posterior auricular and 2 terminal branches, superficial temporal and maxillary. So that is all about the morphology, the structure, the relations of the parotid gland. Now comes the blood supply comes from the external carotid artery. There is a vein inside it, so no problem. There is a parotid duct. So if this is the parotid gland, the parotid duct starts from the anterior border, goes like this, dips at this point, pierces the buccinator and opens above on the side of the second molar. Okay, on the side of the second molar. This parotid duct, because it pierces the buccinator, that buccinator kind of acts like a valve, preventing oral substances from oral cavity to go inside the duct. Nerve supply of the parotid: parasympathetic, sympathetic and sensory. Sympathetic comes from the sympathetic plexus around external carotid artery. Sympathetic plexus around external carotid artery. Sensory comes from the auriculotemporal nerve. Sensory comes from the auriculotemporal nerve. Auriculotemporal nerve is supplying this area, and here is parotid gland. Okay. Parasympathetic कहाँ से आता है पैरासिम्पैथेटिक फॉर पैरोटिड ग्लैंड? Glossopharyngeal nerve. So it starts from inferior salivatory nucleus, glossopharyngeal nerve. बोलो आगे. Tympanic branch, tympanic plexus, then lesser petrosal nerve, then otic ganglion, then auriculotemporal nerve, and then parotid gland. These fibers are preganglionic and after otic ganglion are postganglionic fibers. Huh. Sympathetic is sympathetic plexus around the external carotid artery. देर आए लेकिन दुरुस्त आए. So I told you that there is sympathetic plexus around external carotid, internal carotid. Internal carotid के around जो plexus रहता है that forms deep petrosal. Okay? हाँ? ये मैं सिखा चुका हूं पहले, फिर भी वापस बोलता हूं. Parasympathetic supply to the parotid comes from inferior salivatory nucleus, glossopharyngeal nerve, tympanic branch, tympanic plexus. From the plexus arises lesser petrosal nerve, relays in otic ganglion. From otic ganglion starts, from otic ganglion, the postganglionic fibers, they pass via auriculotemporal nerve. Okay, auriculotemporal nerve doesn't arise from there, it passes via auriculotemporal nerve. So auriculotemporal nerve and greater auricular इधर एंगल को सप्लाई करती है. तो कभी कभी क्या होता है, यहाँ पे कुछ इंजुरी हो जाता है. Sometimes there is injury on the face near the angle and fibers of the auriculotemporal unite with greater auricular while healing. So every time a person eats, greater auricular is stimulated and there is sweating at the angle of the mandible. It is called as Freys syndrome, Freys, Freys syndrome. So what has happened? Injury on the face, greater auricular and auriculotemporal both are damaged, and some fibers of auriculotemporal which stimulate the parotid for secretion, they unite with greater auricular. Greater auricular supplies the skin over the angle of mandible. So this skin there is sweating. Whenever a person eats, खाया तो यहाँ पे sweating होता है, खाया तो यहाँ पे sweating होता है. That is Freys, Freys syndrome.